Good morning, good afternoon, and good evening, and welcome to today's webinar, which is called Ready, Set, Grow, Collective Action for Complementary Feeding. My name is Gráinne Maloney, and I serve as a Senior Advisor in the Nutrition and Child Development section in UNICEF and Headquarters, New York, and I lead on our Early Childhood Nutrition agenda. And I'm delighted to welcome you all today to explore this important agenda item. But before we start our webinar, I would like to share some housekeeping details. If at any point during today's webinar you are unable to hear the speakers, please make sure you're connected to your audio by selecting the headphones icon. So maybe, sign in and sign out again if it doesn't work. Further, I'm happy to report that we have interpretation services available, simultaneous interpretation today. So please check on the interpretation button to choose your channel. Now we have interpretation available in Arabic, Chinese, English, French, Russian, and Spanish. And if you're listening in English, please select the English channel today, because there will be one section of the webinar where we have a different language. So please don't just stay in the main, go and select the English channel. Now, closed captioning in English has also been enabled for the meeting. To view the live subtitles on your screen, click on the CC icon and select to show subtitles. You are very welcome, and we encourage you to submit questions for the panelists and the speakers in the Q&A box. You'll see that along the bottom bar as well. And the panelists will answer selected questions by text or live during a later Q&A session towards the second half of the webinar. Please note that today's webinar, including your contributions to the Q&A and the interactive portions of the event that you will see, will be recorded, and we're happy to report that we will share the recordings with you all in a few days after this event, and we will also post them on our new Global Complementary Feeding Collective website. So we will share those after the event, and we'll share them in all the languages. If you need technical support, please reach out via the Q&A panel. Now, we do have a very packed, ambitious agenda for today. And during our time together, you will hear from speakers on why complementary feeding should be prioritized and why donors are investing in such an important issue. You will also be introduced to this new Global Complementary Feeding Collective itself, as well as the tools that we're making available so that you are well equipped to take action after today's webinar. We hope you will also take a lot of inspiration from our government representatives of 3 countries spanning 3 continents. We are delighted to have government representatives from Ethiopia, Nepal, and Peru, and they will tell you their stories about what they have done to make progress in improving the diets of children in early childhood and what motivates their actions. But first, let's take a step back, and we want to share a new video that's been launched today. It tells the story of why the Global Complementary Feeding Collective is calling on governments, policymakers, and civil society to place the diets of the youngest children at the forefront of global, regional, and national agendas. So let's sit back and enjoy this video. Thank you.
The complementary feeding period, when foods are introduced to a child's diet alongside breastfeeding, is a critical window. This time, from 6 to 23 months of age, sets the stage for health, nutrition, and development for the rest of a child's life. But good nutrition during this period is not simply about adding foods to a child's diet. It's also about ensuring those foods are safe, nutritious, and fed with love and care for their growing body and mind. A child's diet between 6 to 23 months influences cognitive development, future health outcomes, and overall well-being. Yet today, millions of children aged 6 to 23 months are not getting the nutrition they need. Only half are fed often enough, and less than a third receive the variety of foods essential for healthy growth and development. And for many children, this gap is not just about missing nutrients, it's also a gap in the opportunity to thrive. Adequate and optimal complementary feeding is not only about consuming nutritious foods, but also about avoiding those that are nutrient poor and high in sugar, salt, and unhealthy fats. Unfortunately, Many infants and young children are increasingly consuming energy-dense, ultra-processed foods, including sweet beverages, which can displace the intake of nutritious foods and breast milk, contributing to poor dietary habits and increased health risks later in life. In Asia and Africa, 1 in 4 children live in severe child food poverty, getting only 2 food groups or fewer each day. The problem is even more challenging for children in rural areas or from the poorest families, who are less likely to have access to diverse and nutritious foods. Structural barriers, such as lack of access to diverse foods, nutrition services, and community support due to financial and physical barriers, play a major role in determining the quality of complementary feeding. But change is possible. We know what works. We have clear evidence-based guidance and examples of success. By working together to ensure that all children have access to nutritious foods, appropriate services, and supportive practices, we can give every child the best start in life. Collective action is essential to address these challenges. By drawing together the efforts of governments, policymakers, donors, and civil society, we can create meaningful change to improve the diets and health outcomes of young children worldwide. Together, we can close the gap and make sure every child, everywhere, gets the nutrition they need to survive, thrive, and reach their full potential.
So first of all, thank you so much to the families who opened their homes, their mealtimes, and share their beautiful children with us so that we could bring you this beautiful reminder of why it's so imperative that we address the nutrition crisis in early childhood with urgency. Now, I'm delighted to introduce our speaker for opening remarks. So I'm delighted to introduce Dr. Victor Aguayo. Today, he is our Global Director of Child Nutrition and Development in UNICEF, based in New York, and he's here to provide opening remarks. So, Victor, over to you.
Thank you, Gronia. Dear colleagues and dear friends, it is a great pleasure to welcome all of you, wherever you are across the world, for the launch of the Global Complementary Feeding Collective. And it truly is a great pleasure for me to do it with our colleagues from WHO, including Francesco Branca, the Director for Nutrition, and with all our partners. It is a joy to see many people online, many more than I was expecting, because there is so much to celebrate, but there also is such a great mission for all of us ahead. So as always, let's start celebrating, because there is much to celebrate. We can celebrate, for example, that in the past 2 decades, that is between the years 2000 and 2020, we have seen great progress for nutrition. We have been able collectively to reduce the prevalence of child stunting by 1/3, and the number of children suffering from stunting by 55 million across countries and regions, despite very significant population growth. So let's celebrate that. Let's also celebrate that we are reaching record numbers of children with services for the early prevention, detection, and treatment of child waste. For example, last year only, in 2023, we collectively were able to reach 210 million children under 5 years of age, as I said, with early services for the prevention, the detection, and the treatment of child waste. So let's never forget to celebrate what we are accomplishing together, to then move on to what's waiting for us. What are the challenges and the opportunities ahead? So there is still work to be done if we are to achieve the SDG targets for child nutrition. As Gronia and the video were reminding us, still 1 in 4 children under 5 years of age in low and middle income countries lives in severe childhood poverty. These are children whose diets are so severely poor that these diets cannot sustain, cannot support adequate growth and development in early childhood. So 1 in 4 children living in severe food poverty, and 1 in 3 children malnourished, either because they are stunted, they're wasted, they're overweight or obese, or a combination of the above. We are making good progress on breastfeeding and we should celebrate it, but progress on complementary feeding is slow at best and sometimes extremely slow. This is why today we are launching the Global Complementary Feeding Collective, which is a partnership among organizations that are coming together to improve children's diets in early childhood. So in the lead up to the Nutrition for Growth Summit in March 2025, the Global Complementary Feeding Collective is calling governments, civil society, and partners globally and nationally for a collective effort to improve the diets of young children, the diets of children at least in the first 2 years of life, through actions to improve policies, to improve legislation, to improve programs, and to improve convergence. Why is this important? Well, because we need policies that set guidelines on complementary feeding, policies that protect our children from breast milk substitutes and unhealthy foods and beverages. We need legislation, good legislation that sets standards for complementary foods, legislation that ensures that the quality of complementary foods, the safety of complementary foods, and the affordability of complementary foods are within reach for all children and families. We need programs, good programs that ensure the availability and the affordability of nutritious complementary foods for all children. Programs that make sure that all children and families can access nutrition services, and good programs that ensure the use of food and nutrient supplements for children most in need. And finally, we need systems that converge. We need convergence of systems and nutrition actions that converge through the food system, the health system, and the social protection system to ensure that all children have access to nutritious and safe diets, nutrition services, and nutrition safety nets. So in conclusion, today marks the start of a journey of action. And I want to underline this. This is a journey of action for all of us, a journey that we hope many of you will join to engage with the Global Complementary Feeding Collective. We need everyone, and I mean everyone, who is committed to ensure that every child enjoys his right to adequate food and nutrition in early childhood, everywhere, wherever we are. So with that, my gratitude to all of you for being with us today, my gratitude for all of you to joining forces with us today, and I'm sending it back to Gronia, who's going to lead the rest of the event. Thank you very much, Gronia.
Thank you so much, Victor, for those inspiring words. Indeed, it is the start of a journey of collective action with this collective. And we have much to celebrate, and indeed, there's much to do. And I'm delighted to see we have over 400 participants online. So clearly, a lot of you, and you're all here because you also believe in this agenda. Now, at UNICEF, of course, we're always delighted to have our sister agency work hand in hand with us, which is the World Health Organization. And WHO are also our co-lead with UNICEF of this collective. So we're going to hear now from WHO about why they are also very committed to this agenda. So please join me in welcoming Dr. Francesco Branca, who will be sharing his remarks on pre-recorded video. He was unavailable to come live. Francesco is the director of the Nutrition and Food Safety Department at the World Health Organization in Geneva. So let's listen to his words. Thank you.
Good morning and good afternoon to you all. I am happy to welcome you to this global webinar on taking collective action to improve complementary feeding. Inappropriate complementary feeding is a key determinant of multiple forms of malnutrition, such as wasting, stunting, overweight, vitamin and mineral deficiencies, and their short-term and long-term consequences on child health and well-being, including morbidity, motor and cognitive development, increased risk of non-communicable diseases, and reduced work capacity. WHO published guidelines on complementary feeding in 2023 with key messages on the importance of dietary diversity and the avoidance of sweet beverages or foods high in sugar or salt. WHO and UNICEF are now developing implementation guidance on how to improve complementary feeding. The guidance will include chapters on social protection, agriculture, food safety and quality standards, marketing restrictions, counseling, and communication approaches. WHO is also proposing to establish operational targets related to complementary feeding, such as minimum dietary diversity, sweet beverage consumption in children, infant and young child feeding counseling that can accelerate progress on global nutrition targets. The establishment of the Global Complementary Feeding Collective is critical to support countries to transform children's early food environment and improve nutrition with action across sectors, such as the establishment of national complementary feeding guidelines, the improved production of and access to nutritious foods, the provision of quality counseling and nutrition services, the appropriate distribution of micronutrient supplements, the provision of social protection system to make appropriate complementary foods accessible for vulnerable families, and the protection of children from unhealthy processed foods and beverages through ending the inappropriate marketing and promotion of foods and beverages, and through enforcing standards for the safety, quality, and labeling of all commercially produced complementary foods. At today's webinar, we will launch the Global Complementary Feeding Collective. The establishment of this collective is timely on the eve of the Nutrition for Growth Summit, when all nutrition actors are invited to make commitments to improve global nutrition. We hope that the call to action being announced today by UNICEF and WHO will be well received by partners in civil society and governments around the world. Your presence here today is already a show of support. The Global Breastfeeding Collective has promoted the successful implementation of the promotion, protection, and support to breastfeeding that led to a dramatic increase in exclusive breastfeeding rates over the last decade. I am convinced that the Global Complementary Feeding Collective will be an equally successful transformational actor. I look forward to that action.
Thank you so much, Francesco, for those inspiring words and for sharing why the World Health Organization is committed to complementary feeding and investing in today's launch of the collective. We all know that nutritious diets in early childhood set the foundation for children's survival, for children's growth and development. And we know that to make progress, and based on the calls to action from Victor and Francesco, this needs all of us together. So we want to hear from you all today about your experience of advocating for complementary feeding in your country, in the setting that you work in. And we will be using Mentimeter to gather your input today. To get started, please use a browser on your phone or your computer and visit Mentimeter using the link in the chat or the QR code on the screen. The Mentimeter code for this particular part of the agenda is 31404600. I'll repeat, 31404600. And once you get in there, you should see this following question. What is the main barrier that is preventing progress in complementary feeding in your country? So yes, I see some responses coming in. Clearly, many of you are well used to using this tool. And with over 400 people online, we're looking forward to hearing from all around the world the different barriers that you face. So we're seeing a range of barriers being highlighted. Poverty is coming up on several points I notice. Nutrition literacy, links to inadequate knowledge, social norms, again, similar to cultural practices. Of course, commercial influence, cost again. So this is restrictions on income access, education and awareness, social norms. So a lot of replication of similar issues that you're facing from around the world. So clearly financial access remains a huge barrier in many settings, lack of sufficient knowledge in many settings. And then, of course, there's actual access to nutritious food. So even if people have the information and the income, they may not be able to physically purchase or access those nutritious food. And of course, that can be in some part due to something like conflict, which again, I have seen pop up on a few of your answers. Unhealthy environments and low quality health services. So again, the lack of information and access to nutritious food, marketing of low nutrient foods to children and their mothers, of course. Again, this is a concern when children aren't getting the nutrients they need in early childhood. Again, linked to commercial advertising, misleading marketing, similar themes coming through, just phrased slightly differently. Lack of actors, food insecurity, ultra-processed food, too much sugar, cultural influences, social norms. So it's really clear that there's a sort of a few key barriers that are being faced throughout the world. So one being lack of income, lack of insufficient income to be able to purchase the nutritious food that are needed for our children. The increased availability of ultra processed food and the inappropriate marketing of those foods, a lack of knowledge in some cases, a lack of physical access to these foods, a lack of awareness of what should be fed to young children, food deserts. So I think this was really, really comprehensive. So completely agree. And when we're moving through today's webinar, you'll be hearing different examples from different countries about how they dealt with these different barriers. And then when we have our call to action at the end about these are the very same issues that we highlighted about what we need to do to actually start to address these systematic barriers. So now I'm delighted to move on to our next speaker. I would like to introduce you to Dr. Patrick Webb. Dr. Webb is USAID's chief nutritionist and is a globally recognized expert in the fields of nutrition, food policy, and climate change. With an extensive background in humanitarian assistance, he has led groundbreaking research on food systems, micronutrient deficiencies, and food safety. Dr. Webb's experience includes significant contributions to global nutrition initiatives, including his work with the United Nations World Food Programme and his leadership roles in Feed the Future's Nutrition Innovation Lab. He brings a wealth of expertise in complementary feeding and is a key thought leader in advancing nutrition policy and practice worldwide. Over to you, Dr. Webb.
Well, thank you, Grania. That's very, very kind of you. I'm at an airport, so I apologize for background noise. First, thanks to UNICEF, WHO for organizing this very important initiative and inviting me to speak today on an issue that I am actually really passionate about. And just to emphasize that point, one of my most recent peer-reviewed journal articles is on trends, negative trends in complementary feeding in Jordan. So it's an issue that I've researched as well as focused on in practice. So clearly, complementary feeding is squarely at the intersection of health systems and food systems. And I think that knowledge, that intersection is key to making progress going forward. We already heard from the video, appropriate complementary feeding sets the stage, not just for children to grow, but to thrive. And if the right complementary foods are not introduced around the age of 6 months, or they're given inappropriately, infant growth can falter and their cognitive development can be compromised. So improving complementary feeding has already been a cornerstone of USAID's existing multi-sector nutrition strategy, which we're about to refresh and relaunch, as well as our mission implementation and annual plans relating to the legislated Global Malnutrition Prevention and Treatment Act, the GMPTA. So we're doing a lot, but we need to do a lot more in partnership with all of you. Despite our long-standing commitment and knowledge about the importance of complementary feeding, it remains unattainable to so many millions of communities and families. And making complementary feeding that is timely, adequate, safe, and affordable has proven to be extremely difficult, especially when going to scale. UNICEF's Fed to Fail report was actually shocking to me and to many of us, because we know complementary feeding has been a key component of many international nutrition projects over decades. Not enough impact. We know that nearly 2 in 3 children 6 months to 2 years are still not consuming nutritionally adequate diets critical for their growth and development. And the Fed to Fail report reiterates the need to program across both the food system and the health system jointly and simultaneously if we seek meaningful improvement in what children and their mothers are consuming. So that means investments across multiple sectors of activity. This means leveraging market-based approaches appropriately, promoting optimal feeding practices through community health workers and delivery systems, and appropriate social assistance programming. Now, we have a lot of opportunities to do things better, quicker, faster, and greater scale. And the complementary feeding represents an opportunity to address malnutrition in all its forms. I think this is critical, something that Francesco pointed out. So I'm pleased, really pleased, to be able to support today's launch of the collective. This is a concrete step forward to coordinating actions to improve growth, survival, development of children, mainly through identifying and supporting joint actions to support complementary feeding. At USAID, we really appreciate this opportunity to be a member of this new collective. And of course, we want to take this forward to the next Nutrition for Growth Summit. That provides all of us with an opportunity to strengthen many of our financial and policy commitments. And I think we need to put emphasis on complementary feeding at the core of our work going forward. So in sum, USAID stands ready to support all partners, including national governments, in developing and implementing both their own commitments and finding ways where we can support evidence-based nutrition solutions together. And I thank you. Back to you, Grania.
Thank you so much, Patrick. I think you've really highlighted the key points, and it's very reassuring to hear from the US government of your continued commitment and investment in this priority issue, and for reminding us, and as we've heard from several speakers, about the need for a multi-system, multiple sector approach. This is not a health system agenda alone. We need to bring in all of our partners across our organizations, across our governments. And we need to consider, you also mentioned social assistance. There will always be populations that need additional support. So this is a complex issue, but there are opportunities to do more. We know what to do. We just need to do it at scale with quality. And with that, the reminder as well of the upcoming Nutrition for Growth, we have an opportunity to put forward new commitments and really make change so that we can get back on track to reach the SDGs. Now, at the beginning, I mentioned that we are going to hear inspirational words from a variety of government representatives. This is core to our work. We have many countries that have made great progress and have had success in improving outcomes for children in nutrition, in particular improving their outcomes around complementary feeding. So we're going to start in Africa. And I'm delighted to introduce Mrs. Hiwot Darsene, who will share with us her perspectives and her experiences of the Ethiopian government on complementary feeding in Ethiopia. Mrs. Darsene is the lead executive officer of the National Nutrition Coordination Office in Ethiopia. So let's sit back and listen to her. Thank you.
Greetings, everyone. This is Hiwot from Ministry of Health, Democratic Republic of Ethiopia. Nice to present at this platform. Imagine that every child in Ethiopia has the opportunity to thrive free from consequences of malnutrition. This can be achieved by prioritizing proper complementary feeding practice among children 6 and 23 months. Despite the significant progress in reducing malnutrition between 2000 and 2021, still nearly 5.8 million children were stunted. Today, I want to talk about the importance and essential actions of complementary feeding and how it can transform the lives of our children. The importance of complementary feeding is essential for growth and cognitive development. After 6 months, a baby growing body requires more energy and nutrients than breast milk alone. The other one is to reduce the risk of stunting and wasting. It has also long-term benefits such as better cognitive function and reduce the risk of chronic disease in later life. In summary, the consequences of suboptimal complementary feeding practice are not only on the individual child, but also the entire nation and can lead to stunting, impaired cognitive development, reduced productivity, and increased vulnerability to disease. Due to stunting and underweight, each year Ethiopia loses 60.5% of the GDP. There are essential actions for proper complementary feeding since the basic causes are suboptimal complementary feeding, multifaceted, including limited knowledge and awareness among mothers, caregivers, and the community entire. Socioeconomic factors such as access to nutritious or nutrient-dense food, diets, healthcare, and basic water and sanitation facilities. Cultural beliefs and practices are also contributing. To address all those challenges, there has to be a comprehensive approach that focuses on enhanced awareness and education, improved access to resources, especially on the access to nutritious diet, strengthened policy implementation, and multi-sectoral collaboration and coordination between the government, non-government, and non-state actors. The government have a responsibility to have national policy frameworks, which could be the policy itself, strategy, and the guidelines. In terms of health system strengths, it has to be focused on health worker training and engaging the community health workers and empowering the community entirely. The food security and accessibility has to be at the center, especially ensuring access to affordable and nutritious foods. The other one is to promote food safety and hygiene practice to reduce diarrheal disease. The other aspect has to be social and behavioral change communication using different channels. By implementing those strategies, we can improve the child nutrition and development, enhance overall child and well-being, and we can create a more equitable and prosperous Ethiopia where every child has the opportunity to reach their full potential. Let us commit to a future where malnutrition will be history and where every child in Ethiopia can survive and thrive and productive. The time for action is now. Let's invest on nutrition. I thank you.
Thank you so much. What a compelling speech from Ethiopia. And it's clear that Mrs. Darsene highlighted many of the same barriers that you all did in the earlier Mentimeter, and then highlighted some of the strategies the Ethiopian government have taken to address them. So I really feel like she's reconfirming to us a lot of the issues that we've raised, and of course showing us how the government are taking the lead in addressing these at scale. Moving on now, I would like to introduce our next speaker, Ms. Jen Burns. Ms. Burns serves as the Technical Director for Helen Keller International. She brings more than 20 years experience in nutrition and food security programming, which is why she is such an asset on our steering committee of the Global Complementary Feeding Collective, her work in many, many different contexts. So Jen will be speaking to us today on the power of complementary feeding. So over to you, Jen.
Thank you, Grania. I'm going to do my best to not repeat some of the very important highlights, the barriers, the facts that several of our introductory presenters have highlighted. But I will try to leave you with 3 things. One is a very quick reminder of the basics of complementary feeding, which I'm sure this audience knows very, very well, but we're going to leave you with some resources so that you are able to present it in any context in which you're operating. We'll briefly speak to why this complementary feeding matters, and then highlight the current state of dietary practices. Next. Now, we know the definition of complementary feeding, so I'm not going to go over that, but just to state that the food that complementary feeding provides is and particularly important meeting the growing nutritional requirements that is happening in the first 2 years of life. And what helps us to really break it down into actionable steps is the recently published WHO guidelines on complementary feeding. This helps to reaffirm the importance of dietary diversity, as well as topics like food and drinks to avoid feeding to young children, and the role of nutrient supplements, fortified food products where appropriate. The forthcoming implementation guidance will guide users towards putting in place those guidelines. Now, I'd like to have a quick look at just how critical this period is. Next, please. Now, to put the importance of diets in digestible terms, let's look at a few facts. During the first 2 years of the child's life, enormous physiological changes are taking place. And I think this really helps to contextualize it when explaining. Child's brain grows to 75% of adult size. More than 1 million neural connections are formed every second. Body weight quadruples and height increases by 75%. These vast changes mean that the nutrient needs of children under 2 are extraordinarily high. And so much that between 6 months and 2 years, children have greater nutrient needs per kilogram of body weight than in any other time in their life. As we know, children have very small stomachs, so they need to be fed frequently, and these have to be nutrient-dense foods that we are offering them. The frequency and the amount must grow as the child ages. Next, please. This chart is a reminder of the timing of nutritional deficits that occur during the complementary feeding period. As we see, the majority of stunting and wasting occurs in the first 2 years of life. We often refer to this as the window of opportunity, and what it means is it's much harder to correct things after this window. Next. Another way to look at this window is by analyzing the age distribution of stunting and wasting. In this figure, we see the prevalence of stunting increases rapidly between 6 months and 2 years of age as children's diets fail to keep pace with their growing nutrient needs. When we look at wasting, more than half of all children under 5 with wasting are younger than 2 years of age. Next. Now, we heard earlier the reminder of where we are regarding all forms of malnutrition, and I won't repeat those statistics, but just to state that the common denominator for each of these forms represented here is an inadequate diet. Next. Now, earlier we heard from our speakers about some of the consequences of poor diets early in life. And what we want to emphasize here is that these are visible and felt in the near term and the long term. Presented here, you'll see the immediate consequences on the left around growth, morbidity, mortality, deficiencies in essential micronutrients, and impairments to cognitive, motor, social-emotional development. In the long term, we know there are impacts on reduced work capacity, earnings, and among girls, reduced reproductive capacity, which is fueling the intergenerational cycle malnutrition. Overweight, type 2 diabetes, disability, and increased risk of non-communicable diseases are very visible later in life. Note that non-communicable diseases, wasting and stunting, something we've heard several times so far, these are high-level priorities being discussed around the world, and they can be traced back to the complementary feeding period. Now let's take a quick look at what diets currently look like during this window. Next. As Dr. Webb highlighted, UNICEF's Fed to Fail report. This is a wake-up call to the alarming state of children's diets that affect the youngest and the most marginalized. In summary, 27% of children aged 6 to 8 months are not fed solid food. Among children aged 6 to 23 months, 48% are not fed the minimum recommended number of meals, and 71% do not have minimally diverse diets. The low consumption of those most nutrient-rich foods is troubling. Half of children do not benefit from fruits, vegetables, eggs, fish, and meat. And we know while breastfeeding remains an important source of essential nutrients into that second year of life, 1 in 3 children are not continuing to be breastfed. Next slide. Now, one more other very important resource is another UNICEF report, the Child Food Poverty Report. And this helps to present a different startling picture. 1 in 4 children live in what is this new term, severe child food poverty, and it's defined as those consuming less than 2 food groups per day. This is represented by the red bar. Children consuming only 3 to 4 food groups per day, represented by the orange bar, affects approximately 40% of children. And what UNICEF has found is that there is wide variation between regions. 1 in 3 of the children defined as fitting into the red bar, the severe child food poverty, reside in South Asia, Eastern and Southern Africa, West and Central Africa, compared to less than 10% in Latin America and the Caribbean. Next. Now, at the same time, one notable shift in diets, and we heard several of the presenters mention this already, is a global increase in consumption of unhealthy processed and ultra-processed foods and drinks among young children. Now, the reality is this is high, middle, and in low-income countries. The foods and drinks are energy dense, nutrient poor, and they're high in salt, sugar, and unhealthy fats. The Mentimeter presented a lot of these factors already. Convenience is a contributing factor. They're widely accessible, they're affordable, they're perceived to be healthy for children. And then also mentioned the Mentimeter was the persuasive, the misleading, and the unethical marketing practices by the food and beverage industry are driving this increased consumption. Next. Now, in conclusion, while there have been some improvements over the past decade, the progress is too slow to achieve the 2030 global nutrition targets and is not shared equally around the world. And we know that improving complementary feeding is complex. There is no one solution, no one pill, but a set of guidelines that require multi-sectoral coordinated action. Currently, the food, health, and social protection systems are failing families. The food system is failing to provide nutritious, safe, and affordable foods. The health system is failing to provide essential nutrition services, counseling, and support. And the social protection system is failing to provide safety nets to make those nutritious first foods available and affordable to the poorest families. However, we want to wrap up with a bit of optimism and say that change is possible. We've already started to hear today from countries that have made significant progress in improving the quality of children's diets, and much is through the collective will and investment. So we look forward to hearing more stories. Thank you very much.
Thank you so much, Jen, for those words. You make an incredibly compelling case for the need for collective action on complementary feeding and the significance and importance of investing in this age group at scale to prevent all forms of malnutrition. The evidence base is really, really strong. We know what we need to do. We just need to do it, and we need to do it with quality at scale and with a universal approach. So now I'd like for all our participants to get involved again. Now we've over 450 of you online from around the world. So we want to hear from you. What is happening in your settings, in your countries, and what is working well? We'll be using Mentimeter, as you see here, and use the code from the last time, 31404600. or use the QR code on the screen. You can point your phones there. Once you've logged in, please share with us one action that is working well to improve complementary feeding in your country. You'll have heard of many actions from all our previous speakers. So which is the one action you think stands out in your setting that is having an impact on improving the complementary feeding in your setting? And let's have a look. Oh, goodness, somebody said nothing. But hopefully at the end of this webinar, you will be inspired and have lots of ideas about what you can change. We see addressing social norms kind of works. Tax on sweetened beverages. So again, we're seeing different actions here to address the barriers that you were identifying earlier. We have fortifying food, enriching cereals to increase the nutrient value. Infant neonatal feeding, I'm assuming that's around counselling. Household food access, so that coupled with SBC, so that of course increases access to nutritious food. Government subsidies, that's also about increasing access, especially for vulnerable households who are unable to procure and access the foods they can with their own income. So government subsidies are really important for vulnerable and marginalized populations. Counseling, many of you are bringing up counseling. So giving the carer, the mother, the parents, the information they need to make the best decision on what to feed their children. Recipes using locally available products, yeah. Cash vouchers, increasing awareness. Yeah, counseling is coming up a lot. Cooking demonstrations, again, it's around using different information, different strategies to communicate how and what to feed your children. Quality counseling, of course, it's not just about telling people what to do, it's about how do you help them identify what it is they need to do based on the barriers they face. Of course, continuing with breastfeeding, because that must continue alongside complementary feeding up to the age of 2 and beyond. Gender is very important, and many of the social norms can be addressed through gender programming. So I think it's very important and great to see that that has been highlighted, because unless we ensure that we can that carers and mothers are empowered and have agency to make the right decisions, it can be very challenging. There's a mention of lipid-based nutrient supplements such as SQLNS. So indeed, in some cases, there are appropriate products that can play part of a larger program of interventions, particularly for vulnerable populations. Great. So I think we've got a really interesting, comprehensive list here from many of you. And I think, we'll keep thinking about these different types of actions as we're moving through the next hour of our event. So now it's time to actually hear about this collective. What is this collective all about? So I am delighted to welcome Dr. Linda Shaker-Barbari, who will be introducing us to the Global Complementary Feeding Collective that we are launching today. Linda is a nutrition specialist in our UNICEF headquarters, and she leads on complementary feeding. And you will recognize Linda's voice as the voiceover from the earlier video. So now, Linda, over to you.
Thank you, Grania, so much for the introduction. It is really my immense pleasure to be presenting to you today the Global Complementary Feeding Collective, a collective that is dedicated to improving nutrition for children 6 to 23 months through improved programming, policies, and advocacy. Next, please. The collective is co-led by UNICEF and WHO and is comprised of prominent agencies that are dedicated, committed to improving the diets of young children and providing leadership in policy, programming, research, including UN agencies, non-governmental agencies, academic institutions, and networks, as you can see on the screen. Next, please. The Global Complementary Feeding Collective was established earlier this year with the primary aim of simply improving the survival, growth, and development of the youngest children by driving action to support optimal complementary feeding, especially given the importance of diets during the early years, as previously highlighted by colleagues and presenters. I want to mention that, of course, breastfeeding and complementary feeding are closely linked and must work together as a continuum in the first 1,000 days. The priority actions to complementary feeding, however, are often distinct, and therefore the Global Complementary Feeding Collective has this particular clear focus that is on complementary feeding. Next, please. The collective has identified 5 main objectives for its work, including number 1, advocating and really elevating the need for improving complementary feeding at the global level. Number 2, identifying what are these priority actions for improving complementary feeding. We will share with you some of these actions later in this presentation. Number 3, facilitating alignment of initiatives by providing the needed resources and tools. Then, of course, capturing and sharing knowledge and learning, as well as tracking and communicating progress related to complementary feeding through a global scorecard. Next, please. And so, in line with its objectives and in an effort to really advocate for these essential actions for improving the diets of young children, the Global Complementary Feeding Collective has issued its first call to action. And quoting Victor here, who's highlighted the journey of action, and therefore here are the 8 actions that the Global Complementary Feeding Collective is calling for. I'm happy to present these to you, and feel free to visit the recently launched website to download the advocacy brief and call to action. So the first action is to establish national guidelines on complementary feeding, national guidelines that specify what, how, and when to feed children aged 6 to 23 months, guidelines that promote the use of nutritious foods, that are aligned with global standards and that address the local drivers of poor diets. Of course, these require strong political commitment and leadership and are important as they also get integrated into existing facility, community-based child nutrition programs. Number 2, speaking of the food system, to stimulate the production of and access to nutritious foods that can be included in young children's diet, including locally produced, and in particular for those children who really need it the most, and in particular in challenging contexts. This means having to work on strengthening the food system to make those foods available and accessible. Number 3, we heard a lot about this in the Menti to address barriers and norms and practices. It is crucial that governments deliver quality counseling and nutrition services by investing in community health, nutrition workers, especially in areas that are underserved. We know that caregivers need support to overcome these barriers, and this can be done through tailored quality counseling for behavior change. Number 4, for vulnerable children who do not have access to nutritious foods and who are at risk of malnutrition and also are in food insecure and or in humanitarian context, important to provide the appropriate food supplements and home fortification in order to prevent malnutrition, including micronutrient deficiencies, wasting, and stunting. Next, please. Now, when it comes to food on the market, 2 policy actions are important to address. Number 5, the importance of setting and enforcing standards for the safety, quality, and labeling of commercially produced complementary food. That is to ensure that foods that are offered to children align with global standards and do not present a risk, and that are safe and have good quality. And then number 6, the second policy is to protect children from the harmful marketing and promotion. And we've seen this in the Menti a number of times, and that is by implementing and enforcing the WHO guidance on ending inappropriate marketing and promotion of foods for young children. When we think of breastfeeding protection, the first thing that comes to mind is the code, and we have a lot of learning from that. But then when it comes to foods marketed to children 6 to 23, our go-to guidance is really one that aligns, of course, with the code, is that WHO guidance on ending inappropriate marketing. And we are, I think, pasting a link of that guidance in the chat. To ensure access of nutritious foods, so number 7, especially for vulnerable families, and we've also seen in those mentees the mentioning of poverty, of access, social protection, and this action is particularly on that. Social protection is key. It is important to leverage the system, the social protection system, to make nutritious foods that can be included in a young children's diet accessible to vulnerable families and in fragile contexts. Finally, we need to be able to monitor our progress. We need to be accountable for these actions. We need to make sure that these actions are leading to change, and therefore the last action is really about that. I encourage you to download the advocacy brief and inspect these actions to help you start with this journey of actions. Next, please. In addition to that, and in an effort to improve on policies and programs, our newly established website will have essential resources related to complementary feeding. As mentioned previously by Francesco and Victor, WHO and UNICEF are currently working on the development of an implementation guidance for complementary feeding policies and programs, which will be available next year. Meanwhile, you have a collection of resources that are available for you on the Toolkit and resources page. Next, please. Finally, in order to be able to track progress related to complementary feeding, the collective has started a discussion around the development of a scorecard that tracks select indicators at the country and regional level, and that helps us really see the progress in those 8 actions, as well as the indicators related to complementary feeding. What you see on the slide is just an example of the upcoming work, so please do watch this space. In conclusion, I'm really delighted to have had the chance to share with you a bit about the collective, hoping that this is indeed the start of a journey. Here's a summary again of the 8 actions that the collective is calling for. And with that, I hand over back to you, Grania. Thanks.
Thank you so much, Linda, for introducing the collective and highlighting the many resources that are available on the collective website. And I welcome all of those of you online, over 450, to check in on the website, look for the resources that are important for you. And also you'll find that the call to action has some very important language that can be helped in crafting the commitments towards Nutrition for Growth Summit next March in Paris. So please do check in there regularly. We will be updating the website and the toolkit as new resources become available. And we hope that you find all the material that is of help to you there. We all really look forward to making the collective move forward with all of your support. Finally, we will be posting all the video recordings in the different languages of today's launch webinar on the collective. So you can also check in there. We'll let you know when it'll be posted in a few days, and share it with your colleagues who are unable to join today, and of course with other colleagues in your countries. Now, moving on, as mentioned earlier, we've already visited Ethiopia to learn from the Ethiopian government about what they've been doing to improve the diets of children in early childhood. Now we're moving back to the Americas, to Latin America, and I'm delighted to welcome Miss Jessica Nina de Guzman, who's going to speak to us from Peru. She is a Vice Minister of Social Benefits at the Ministry of Social and Development Inclusion in Peru. In her video remarks, she is going to tell us about why Peru is so deeply values a commitment to complementary feeding. And we really look forward to hearing from her, given the extraordinary progress Peru has been making in improving nutrition outcomes for young children. Note her remarks will be in Spanish, so if you are listening in English, make sure you have selected English as your channel, so then you will hear the simultaneous interpretation. Thank you. Please run the video.
Hola, desde Perú. muchísimas gracias por la invitación. Feliz de poder participar de este espacio y poder transmitir esta apuesta que estamos teniendo por la primera infancia. He tenido la oportunidad de ser parte de la construcción de esta historia que implica realmente trabajar por los niños y las niñas del Perú. Y como madre, estoy totalmente convencida de la importancia que significa la alimentación complementaria de nuestros hijos e hijas. Sé que no es una tarea fácil, primero asumir la lactancia materna y tener la convicción de cumplir la cabalidad por lo que ello significa para el desarrollo de nuestros hijos e hijas, y luego pasar a la alimentación complementaria con muchas ansias, con mucho anhelo de que empiecen realmente nuestros hijos a recibir la alimentación que necesitan para su crecimiento, para su potencial desarrollo y sean niños y niñas inteligentes. Y no es fácil. Yo recuerdo mucho que buscaba recetas que me ayudaran a poder darle ese balance en la alimentación desde que cumplían 6 meses y luego a los 7 y a los 8. Y cada mes de nuestros hijos e hijas la vivimos con mucha expectativa, también con mucha ansiedad de poder realmente cumplir ese rol de padres o madres que tenemos. Y ahora desde el gobierno, y no solamente ahora, desde el Ministerio de Desarrollo e Inclusión Social, que tengo la gran tarea desde este ministerio de poder trabajar de la mano con los programas sociales, que son programas de protección, poder trabajar por los niños y niñas más pobres de nuestro país. Y allí el reto que tenemos desde hace muchos años, con grandes satisfacciones de haber podido en los últimos 14 años, 15 ya casi, de estar trabajando fuertemente por reducir la desnutrición infantil, podemos decir que el Perú viene avanzando, ha avanzado con paso firme en la reducción de cifras que eran alarmantes. Ahora poder decir que seguimos en una ruta clara, con intervenciones efectivas, basadas en evidencia de lo que tenemos que hacer, pero también con grandes desafíos como es la anemia infantil. Y sabemos que la anemia afecta muchísimo más a niños menores de 12 meses, donde la alimentación complementaria constituye una de las intervenciones más claras, más efectivas para que nuestros niños y niñas no solamente no tengan anemia, sino puedan tener todo ese desarrollo que realmente esperamos para que puedan tener un futuro distinto, el mejor futuro que todos soñamos para ellos y ellas. Así que estamos trabajando fuertemente en estos retos. Sabemos por toda la evidencia que lo que hay que hacer es un trabajo conjunto, un trabajo multisectorial, y desde el gobierno, desde el ministerio, estamos trabajando sin cesar por los niños y niñas de nuestro país. Queremos hacer la diferencia para que realmente a través de estas intervenciones, en la etapa más temprana, desde la gestación y en el primer año de vida principalmente, en los primeros 1000 días, como lo establece la evidencia, podamos realmente hacer que nuestros niños y niñas tengan ese desarrollo que tanto anhelamos para un futuro distinto, un futuro de un país que queremos todos, un país próspero, un país con equidad, un país donde todos y todas tengamos las mismas oportunidades, y poder cerrar esas brechas que nos ayuden a realmente salir de muchas situaciones y hogares en situación de pobreza puedan realmente salir de ellas. Así es que estamos trabajando nuestro compromiso en ello, y les agradezco nuevamente por la invitación. Hola, desde...
So thanks so much to the Vice Minister for taking the time to share Prue's story with us. It's really brings home the importance of complementary feeding for our children. And I thought it was really important how she reminded us at the beginning that as parents, it's not always easy to achieve the goals. And that's why we need government systems and policies and strategies to help all parents achieve the nutrition goals for their children. Of course, congratulations to the government of Peru for their success so far in the reductions in child malnutrition and for the focus to continue to make progress using a multi-sectoral approach and, of course, an equity lens through social protection. And also for reminding us on the importance of addressing anemia in early childhood, as often we don't give it the attention it deserves. Now, moving on, I'm delighted to introduce our next speaker, Dr. Lawrence Grummerstrawn. Larry is the unit head for the Department of Nutrition and Food Safety at the World Health Organization, and he will share with us a number of key moments where it will be possible to elevate complementary feeding, as well as get involved over the next 12 months, and where you can use these new resources from the Global Collective, such as our call to action, and the other various important resources in your journey to improve complementary feeding in your setting. Over to you, Larry.
Thank you, Grania. And good morning, good afternoon, everyone. As Linda just said to us, one of the key missions of this new collective is to drive action at a global level on optimal complementary feeding. We launched this at the end of 2024, and I think is a very opportune moment for us because 2025 is going to be a year of huge opportunities for doing advocacy at the global level around nutrition. And we need to look for how do we actually make sure that complementary feeding is a key part of that story over and over. Next slide, please. So when we look at 2025, we have some huge moments that give us the opportunities to call for what needs to be done. We have the Paris Nutrition for Growth Summit coming up at the end of March. The World Health Assembly will be looking at the extension of the global nutrition targets in May. In September, the UN General Assembly will be looking at the closure of the Decade of Action on Nutrition and taking stock on what has happened and what needs to happen going forward. And then in November, we'll see the Sun Global Gathering, shaping the future of all of the Sun member states. Next slide, please. I want to talk through each of these as key opportunities and what we might really want to focus on within each of these. The Paris Nutrition for Growth Summit is going to be an opportunity for making commitments. It is really a commitment driver to hear from governments. What are they willing to say they will do to move forward on nutrition? And we want to make sure that we're calling on those governments to call for action on the complementary feeding. Also be hearing from donors, civil society organizations, UN organizations, private sector, all coming together and saying, what are we going to do to make a difference here? And when you see the themes that are going to be focused at this Nutrition for Growth Summit, you see they echo very much the same kinds of areas that Linda was laying out as part of our call to action. We need action in health systems, in social protection systems, in food systems. We need to be looking at these issues in an emergency setting. We need to be looking at gender issues, financing and accountability. How are we actually going to move this forward under each of those themes? You can clearly see how complementary feeding is critically important there. Next slide, please. The World Health Assembly is going to be looking at the extension of the global nutrition targets. At this point, they expire in 2025, but there's been a lot of discussion about how they could be extended out to 2030 to line up with the timing of the Sustainable Development Goals. As has been said many times today, wasting, stunting, and overweight are closely related to complementary feeding. And to move these forward, WHO is proposing not only looking at these health outcomes of how children are doing, but we also look at the kinds of interventions that are needed and the process indicators or operational targets of what can we move forward on this. And we're proposing that there be 6 operational targets to move these outcome targets forward, things that we can actually take action on in a short time frame. Counseling is one of those 6, and you can see that it clearly has impact on wasting and stunting as well as on overweight. It also has impacts on breastfeeding. Next slide. Not specifically an outcome of complementary feeding, but that counseling will have those additional benefits so that as we're talking about the complementary feeding, we're setting up that breastfeeding is there as something that we're complementing too, so that these two work very closely together, and that operational target addresses both of them. Next. We also are proposing an operational target on minimum dietary diversity for children, which has relationships to wasting, stunting, and overweight. We know that as children get more diverse diets, they are protected by having more foods, but also a healthier variety of foods so that they're not supplanting them with ultra-processed foods that lead to overweight. So this is another one that is connected to all of the targets going forward. Next slide. We're also proposing a look specifically at sweet beverages, that the marketing and the selections that are made and how what we do with our counseling are shaping the kinds of behaviors to prevent overweight going forward. So we'll be having conversations at the World Health Assembly about, do we actually accept these operational targets? Does the world commit to moving these forward? And we hope that there will be considerable advocacy moving that forward. Next slide. We have a number of activities leading up to those. We'll be doing a webinar series next week to really focus on what is needed for each of these. And Christina has just put into the chat a link to where you can register for that webinar series. There's a resolution that has been submitted by Ethiopia and Ireland for consideration by member states about how to move these forward. There is a policy brief series that we'll be publishing in January, really highlighting each of these areas of work. And clearly, complementary feeding is a key component of the actions that are needed to move these along. We'll have the meeting of the executive board in early February to consider this resolution going forward. And then at the assembly, the formal adoption of them, along with side events to really talk about what actually is needed in the actions going forward. Next slide, please. The next major event next slide. The next major event will be the General Assembly of the United Nations. We had a decade of action from 2016 to 2025 that really focused in on how we were going to end malnutrition in all its forms by the year 2025. Clearly, we're not there yet, and it's unlikely that we will be there. But it is an opportunity for the world to come together at a higher level, so that we're not just talking to the health systems directly, not just to food systems directly, but we're actually trying to take this to a broad government-wide approach, systems-wide approach. How do we actually all work together? This has been the focus of the decade over the last 10 years, and it'll be an opportunity for the world to say, what have we done? What else do we need to do going forward? Next slide, please. And finally, we have the Sun Global Gathering that is focusing similarly on systems approaches, looking at food systems, embedding nutrition across both health and social protection sectors, financing for nutrition, and looking at how we're actually going to be innovative and come up with new technologies that might help us move forward on complementary feeding. This is an opportunity for those member states to work together to really start taking all of these commitments and the directions going forward and turn it into implementation, where donors are actually talking directly to the governments. How are they going to work together? How is civil society going to be supporting them? And really having those conversations country by country so that we can really move this agenda forward. I think it's going to be a very exciting year for all of us, and I hope that complementary feeding becomes a major message that we're always sharing throughout all of our activities going forward into 2025. Thank you.
Thank you so much, Larry. You've really provided a very comprehensive overview of the opportunities and the events coming up in the next 12 months. And I'd like to remind all of you online that we will make these slides and recording available. So I know you're probably frantically taking notes, but they will be available to you in the coming days. So you can go back and spend more time going through them. So just before we move on to our next speaker, I'd like to remind you we'll soon be going into a Q&A session. So please put your questions in the Q&A box, because some of them we will take and we will answer live. Some of them are being answered directly by text, but we will select a few for the live. So if you have some compelling questions, please pop them in the Q&A box now, and it can be for any of the speakers. So now we have been to Peru, we've been to Ethiopia, now we're moving over to Asia. And I'm absolutely delighted to introduce our next speaker, Dr. Bibek Kumar Lal. Dr. Lal is the Director of Family Welfare Division at the Ministry of Health and Population in Nepal. And of course, Nepal has made great progress also on improving nutrition outcomes for young children. So let's sit back and enjoy his remarks. Thank you.
Namaste, I am Dr. Bibek Kumar Lal. I am working as the Director of Family Welfare Division in the Ministry of Health and Population of Nepal. In Nepal, 1 in 4 children under 5 suffers from stunting due to inadequate nutrition. Complementary feeding, that is, introducing safe, nutrient-rich foods alongside breast milk at 6 months, plays a vital role in supporting healthy growth and development. Imagine a future where every child in Nepal receives the nutrition they need to grow, thrive, and reach their full potential. By improving complementary feeding practices, we are not just nourishing children today, but also investing in healthier generations. In Nepal, improving complementary feeding faces challenges such as limited access to nutrient foods due to low household income, lack of awareness, harmful traditional feeding practices, the abundance of low-cost, unhealthy foods, harmful food marketing, and unsafe water. Many families, especially in rural areas, struggle to provide the right nutrients for their children. However, change is underway. Through a nationwide multi-sectoral nutrition program, Nepal is transforming its food and health systems to tackle malnutrition. Community-based services led by female community health volunteers provide essential nutrition counseling and support to improve the feeding practices. Programs such as the Child Cash Grant also help mothers afford nutritious foods for their children. In rural villages, the Mothers Group initiative teaches women to prepare nutritious meals using local ingredients like lentils, vegetables, leafy greens, and eggs. These mothers are not only nourishing their children better, but also sharing this vital knowledge within their communities. In Nepal, improved complementary feeding practices are transforming children's lives. With better nutrition, we are seeing a significant reduction in stunting, as children are growing healthier, stronger, and reaching their full potential. Health indicators reveal an inspiring story: fewer infections and lower child mortality rates. Communities too are thriving as the children grow into healthier adults who can contribute productively to their families and society. This change is about more than just food. It is about building a stronger foundation for our next generation. The government of Nepal's commitment to improving complementary feeding is crucial for our nation's future. By ensuring right nutrients at the right age for every child, we lay a foundation for healthier, stronger, and more capable future generations. Government support through policies, resources, and community programs empower families and strengthen public health systems, thus paving the way for a more prosperous and resilient Nepal. This commitment is more than an investment in nutrition. It is an investment in every child's potential, every family's well-being, and a stronger, brighter future for our nation. Our actions today can transform children's lives and futures. By supporting complementary feeding, we are giving children the opportunity to grow healthier and learn better. Whether through advocacy for resources, transformation of food systems, or effective social protection programs, every effort matters. Together, we can break the cycle of malnutrition and build a future where every child gets the nutrition she needs to thrive. Let's nourish our children today to build a brighter, healthier future for everyone.
Wonderful. Thank you so much, Dr. Lal, for highlighting again the same barriers that we see repeating from all the different speakers and from the Mentimeter that many countries are facing today, but also highlight how the government in Nepal is transforming their food and health systems to address these barriers, along with enabling social protection for vulnerable communities. So really a real-time example of the implementing the multi-system approach we all know is needed, and it is leading to positive change in Nepal. So very impressive and inspiring. Now it's time to go to our Q&A section, and I'm delighted to introduce Ms. Diane Baik from one of our Complementary Feeding Collective members from World Vision International, who is kind enough to lead us on this conversation. So over to you, Diane.
Thank you, Grania. If you haven't already and you have some questions, you can use the Q&A button on the bottom to click and to ask the questions that you have. But we have been receiving questions throughout the presentations, and so I will begin with those that we received. We have several, so I will begin with the first. Larry, can you share the research which shows that complementary feeding is related to malnutrition, such as stunting and micronutrient deficiencies? And we know you initially answered that there has been a systematic review that was done, but there was a following comment that it seems like the evidence is limited or that the quality of research is low. So if you could address that first.
Okay, Diane. So it's not just a single systematic review. I put in a link there to a whole series of systematic reviews. And it is true, it's a very complex literature, lots of aspects of complementary feeding. It's not like we can say complementary feeding itself answers the question. You have to look at what pieces of that. As far as the quality of evidence, when we look at quality of evidence, the usual standards for that are against kind of randomized control trials. And we typically don't have much research where people randomly say, let's see if we give this child extra eggs, does that actually improve their ultimate outcomes? And we know that diets are very complex. So it's a difficult area to do that kind of randomized trials. So the evidence is a little bit weaker, but we definitely see population-wide reflections, such as we know that dietary diversity is closely related with stunting, and we can track that out. We know the basis of obesity clearly comes from unhealthy foods that are being offered. So I think that pointing to a specific study is not going to be the answer there, but I think there is plenty of reason to believe that this is a strong link.
Thank you, Larry. The second question is directed to Linda. Can you share plans to address complementary feeding needs in emergency and disaster settings? And I'll also share the third question. How do organizations join the collective? So over to you.
Sure, thank you. With regards to emergencies, of course, there is the upcoming implementation guidance that will have a dedicated section related to complementary feeding in emergencies programming. And so inviting all to watch that space for this very important programming guidance. However, on the resources page, you can also see available existing resources on complementary feeding in emergencies that are already published. And of course, with the collective, there is direct liaison with the Infant Feeding in Emergencies core group, which has also a mandate related to improving infant and young child feeding in emergencies, and complementary feeding in emergencies is part of that. This is in relation to emergencies. Of course, there's a lot of learnings, and particularly in the most recent emergencies, and hopefully we'll have the opportunity to document those learnings. On joining the collective on the website, there is a contact email that you can send. Organizations should be sending a declaration of interest, and there are some details that will be shared by email as you send us this inquiry. Thank you.
Thank you, Linda. And we have a couple questions for you, Grania. Recently, the promotion of instant baby food in Indonesia has been quite massive. In your opinion, which is more important, homemade food or fortified instant baby cereal? And the second is, could you clarify how this global initiative will work with existing global initiatives aiming at promoting nutrition? I think some of this was already covered by Larry, but yeah, if you want to share a little bit more about that. This could be Grania or Larry.
Thank you so much. I think it's very important that we refer to the really important resource that were released recently, the new WHO guidelines on complementary feeding. They really clearly outline the evidence base for what we should be feeding young children. And ideally, we should be using nutritious, locally available home food, which can meet the children's nutrient needs. And if you look at the guidelines, they clearly articulate the types of foods that children need. We have our different food groups that we want our children to have a very diverse diet. We want them to have the quantity they need. So certainly it's a diverse and appropriate foods that we want our children to be consuming. And the inappropriate promotion of foods that are high in sugar, high in salt, high in fat, which many of these commercially produced foods are not appropriate for young children. There are certain situations in very food insecure and fragile contexts where the use of supplements is appropriate, and there are some recommendations on those, especially where there's high iron deficiency, or where there's basically, if there are other foods are not available, there are appropriate supplements that are recommended. But in most cases, the use of nutritious home foods that are available in the community, available on the local market, that are consumed by the family are the appropriate foods for young children. So we certainly would not be promoting commercially produced complementary foods that do not align with the nutrient profile needs for young children. Most countries, and this is why we're suggesting to have nutrition guidelines, because countries can define for their children what are the nutrients those children need to eat in the first few months of life, in the first few years of life, and then setting up and adapting then food compositions and recipe books according to the foods that are available that meet those nutrient needs. So obviously different foods will be used in different settings, but we need to make sure that our children are consuming animal sourced protein, lots of dark green leafy veg, and of course fruits. So it's really finding out what's available in that particular context, what's available in the market, what's consumed by the family, and then making sure that the foods that the child are consuming are meeting those specific nutrient needs. So I would welcome everybody to go to the new WHO guidelines on complementary feeding, where the specific details are provided, but where it's very clear that the promotion of home-based, locally available foods, locally grown foods are definitely a priority for young children. But we just need to make sure that they are receiving all the nutrients they need to grow well, which includes obviously animal source protein and iron, heme iron, so that children don't become anemic. Thank you. Larry, did you want to add and to expand on the second part on the sun? Thanks.
I don't think so. I think in the interest of time, we should move on to the questions. You're fine.
Great. Thank you, Larry. Yeah, I think that brings us to the end of the Q&A because we're running short on time. So I would like to pass off back to Grania and Larry. Thank you.
I think I'll pick it up here with one more Menti question coming up next here. We can bring that up on the screen, Jeanette. We just wanted to end our webinar this week with reminding you of what the call to action is. As we move into a question, we really want you to think about, in your context, what is the one thing that you can commit to working on? And so first, just think about across these 8, what would be the one of the 8 things that you would find particularly important in your area that you can take some action on? And just get that in your head. Just pick one of these that you think that you can really be focusing in on. Give you a couple minutes just to kind of read through the list and make your decision of where you would want to go next. And then, Jeanette, if we can bring up the Menti again. So open up your phones or your devices to go back to Menti and put in the code or the QR code. And what we'd like to do is have you address this question. What is the one step that you can take for that particular action area? So I said among the 8 areas, pick one that is the one that you really like to focus in. And we'd like you to give us some text on what it is that you actually can do in that area. What is the action step that you can go forward? Because this is all about action. This isn't about coming to a webinar and just hearing what other people are doing, what the opportunities are, but really for us all to say, in our own context, how can we move this forward? So we'd like to see some ideas of what's coming from you as to what you can take along. And if we're starting to get some answers, I'll turn it over to Grania to start summarizing some of what we're starting to see here.
Thanks, Larry. Fantastic. So awareness, great. I think it's getting the story out about the situation affecting the diets of children in early life and what we need to do about it and what we can do about it. So I think that's a great point, and you can do that through sharing the recording of this webinar, through sharing the resources from this webinar. Policy advocacy is crucial. We have to have governments in the lead, and I think we've heard some fantastic examples from our 3 government representatives on what they have done to make a change in their country. So how do we support our national governments with evidence, with guidelines that have been mentioned, the importance of having guidelines so that we know what it is that we're putting in place for policy and programs and legislation to ensure that our children have the right complementary foods and practices to grow well. More evidence-based research on the role of SBCC, I think that's very important. It's not just about passing messages, it's also about changing behavior. How do we do that in an effective way? Creating an alliance on first foods, more quality counselling, again, that's such an important point. More national guidelines free of conflict of interest. Very important that the guidelines are free of conflict of interest and that they are in line with the global normative guidelines from WHO. I like, we've got now the reference to using digital tools and platforms and AI. How do we use these tools to get better at doing our work, to increase efficiencies and to make us more effective at what we do? And of course, lobbying policymakers to resist the appeal of the ultra-processed foods. And we do have a lot of expertise through the code, which also includes, of course, World Health Assembly Resolution 69.9. So there are the tools and the resources existing there for us to include in any national legislation to make sure that our populations are also protected from inappropriate promotion and marketing of breast milk substitutes. So I think in the interest of time, we're coming to an end, but I'm really thrilled to see such a diverse range of actions. Obviously, there's a lot of enthusiasm online. And I think I would just like to take this moment to thank you all. Many of you, we've stayed just over 300, close to 350 for the full 90 minutes. We had over 400 for the first hour. And there's a whole team working behind the scenes to have made the success of launching the collective today, but also in creating a lot of the resources that you will have seen. So many thanks, obviously, to the whole team here and all the different partners. This is our task force who really put together a fantastic session today. So thanks to you all. I won't read them out, but thanks to you all for making today such a success. And to all of you online, please get involved. You know what to do. We have many opportunities to make a change. We now have this collective. Please reach out for resources. Please, reach out to us if you want to be a member. We've shared the process of how to do that, and we look forward to collective action and to making progress on achieving the SDGs by 2030. So thank you all very much. Goodbye, and have a great rest of week.